Hello, Dr. D here. Today we're going to talk a little bit about braces. I got these things ready for you so you'll have a better understanding of how dentists make room for crowded teeth. Alright, here we go. Okay, so let's pretend that this is the bone that holds the teeth in place, and these white things here are your teeth. Let's put them in the bone. The bone holds the teeth in place. Alright. Whoa, look at that. Doesn't fit. Let's try to work it out here. Okay, well, it is crowded. We don't have space for this. Alright? We don't have space for the teeth. Now, there's many factors why a person would not have enough space for the teeth, or a crowded teeth have many reasons. One, the bone may be too small. The arch, the bone that holds the teeth in place may be too small. The teeth may be too big, or it could be an imbalance between the muscles of the tongue and the muscles of the lips. How do dentists fix this? Well, there's several ways. One way is to remove teeth. We remove teeth from the back, for example, and make room for the teeth. The problem with this method is sometimes you end up with residual space, and now you have to close that space. Alright, that's one. Now, one way of fixing crowded teeth is by expanding the bone. Once the bone is expanded, then you have more room for the teeth to be aligned and straightened. Okay? Now, sometimes a dentist would create the illusion of a wider bone or expanded bone, but in reality it's just flaring the teeth out to accommodate the width of the teeth, and therefore leveling and aligning them in a very nice manner. Another way to fix this crowded problem here is to slenderize the teeth. Now, this obviously doesn't fit. What if we trim the teeth on the side like so, all right? Trim a couple of teeth, make room, okay? And there you go. Now, some patients don't want their teeth removed, some patients don't want their teeth trimmed, but the reality is these are valid options. Sometimes, though, dentists would try their best to avoid removing teeth structure. This is called IPR, or interproximal reduction. Slenderizing, they would tell you, simply because these areas, according to experts, would now be prone to decay, and sometimes it even causes sensitivity. So it's just a matter of being conservative and educating the patient about the pros and cons of this procedure. And there you go. I hope everybody liked the presentation, and hopefully it educated you a little bit on what actually happens when dentists try to make room for crowded teeth. And don't forget, see your dentist every 6 months, brush and floss every day. Dr. D, over and out.